Hey guys, it's Dr. Childs here again, and today I want to talk to you about this blog post that I created, and it's on 5 reasons why Armour Thyroid isn't helping you with weight loss. Okay, and this is a hot topic I hear from a lot of patients, and so I'm going to dive into that in a lot of detail here. Before I do, I just want to introduce myself to you guys if you don't know me. This guy over here, Dr. Childs. And this is my website, and this is the blog post we're going to be talking about today. I'm really grateful that this post has over 600 shares at the time of this filming, and so I hope that you'll find a lot of value in it as well. And if you do, please feel free to share it or post it to your timeline or whatever you'd like to do there. So let's dive in though and get to the meat and potatoes here. And I'm going to answer this question to begin with, but does Armour Thyroid actually help with weight loss? The answer is yes, it definitely can help with weight loss. And unfortunately for the majority of you, it won't. And so I'm going to explain what's preventing it from helping you with weight loss, okay? But before I do that, I want to answer this question, does it actually help? And show you that it does. Okay, so what I've done here is I've shown 2 studies. The first one talks about conversion from Levothyroxine, which is a T4 only medication, to Armour Thyroid, and it shows that in this study patients did experience an increase in patient satisfaction. And normally in these studies, patient satisfaction is defined as an increase in well-being, a decrease in depression, and sometimes weight loss. And so it definitely helps in this study. And then to answer the question, does it actually help with weight loss? Here's another study that shows you that it does. So I'm going to go, this is a study you can look up on PubMed if you'd like, but essentially the title is Desiccated Thyroid Extract Compared with Levothyroxine in the Treatment of Hypothyroidism, a Randomized Double-Blind Crossover Study. So this is a fancy way for saying they took patients who were on T4, switched them to NDT and vice versa, and then they compared the results, and then they asked the patients how did they feel, they checked their weight, and they quantified all of this data. The conclusion of the data, and you can go through and read this if you'd like more information, but it's saying that, well, this specific data said that it did not result in an improvement in quality of life. However, the DTE, which is the desiccated, that's what this stands for, desiccated thyroid extract, caused modest weight loss in nearly half of the patients who were studied, so about 48.6%, and those patients expressed preference for the desiccated thyroid extract over levothyroxine. And I find this kind of interesting because that comment that it did not result in a significant quality of life improvement, I think was made primarily by the authors, because if I switched you on medication and you lost 10 pounds, I think you'd probably be pretty happy. So take that with a grain of salt and just know that yes, it does actually cause, or it can, I should say, it can help with weight loss in certain individuals for sure. And in this study, up to 50% of those that were tested, which is, I would say, pretty significant. So really the question is, why did those patients lose weight and why aren't you? If you're reading this article, the chances are you've been switched to Armour Thyroid from probably T4 medication and did not experience that weight loss you were hoping for. And I would say that that's actually quite common. So you're not alone in that scenario, and I think a lot of the times patients really are in this mindset where they believe that if they could just switch medication from T4 to NDT, all of their problems will be resolved. And I'm going to explain that a little bit, how that's actually not true. A lot of the time patients have a tendency to blame all of their symptoms on hypothyroidism or low thyroid function, and the truth is hypothyroidism sets the body up for multiple hormone imbalances that have to be addressed if you want to feel better. So treating the thyroid is just one small part of that puzzle, okay? So I just described here that you can have multiple other hormone imbalances causing weight loss resistance. You could switch medications but maintain a poor diet. You could switch medications but have too much stress. If you have any or all of these, which I'm sure several of you have multiple of these, it's going to limit your progress here, okay? But let me talk specifically about probably the 5 main reasons that patients don't lose weight when they switch from levothyroxine to Armour Thyroid. And I do want to take a second here. I just got reminded because I saw it up here. But if you like what you're reading here, please click this +1 up here this is to my Google Plus profile, if you don't mind and you've enjoyed this content, and I'll try to give you as much great information as I possibly can. Okay, so let me come back. So number one of the top 5 reasons why you're not losing weight on Armour Thyroid, number one is you aren't being dosed correctly. Okay, and this happens a lot. I'm going to explain this in detail, but what happens is many doctors, since they're not familiar using natural desiccated thyroid like Armour Thyroid, but this also includes NatureThyroid and WP-Throid, and any of the other NDT sort of brands that are out there. Doctors, when they switch from T4 to NDT, they use this conversion chart. So if you were to just Google thyroid conversion chart, this would show you, or this would pop up first, and it would show you what the recommended dosages are and how they compare to one another. So in this example, I'm showing you here that 1 grain of NDT is equal to about, according to them, and I'm going to show you how I think that's false, about 50% what is you actually might need. But they're saying 1 grain of Armour Thyroid is equal to 100 micrograms of T4, Synthroid, Levothyroxine, Levoxyl, whatever it is that you're on. Okay, and so if you're on, like, let's say you're on 100 micrograms and you're like, doctor, I really want to switch, and they'll say, oh, okay, we'll switch you, and they move you to 1 grain, which is 60 milligrams of Armour Thyroid, and a lot of the times you may feel like crap. You may actually gain weight, your symptoms may return, your TSH may go up, your free thyroid hormones may go down in your blood work, and you're like, well, what the heck is going on? And I'll explain why. Part of that explanation includes what you have to realize what natural desiccated thyroid contains, okay, and what it contains is 38 micrograms of T4 and 9 micrograms of T3. Okay, so let's put this into perspective. You're going from 100 micrograms of T4 to 38 micrograms of T4. Okay, so that's you're dropping 62 micrograms, and you're only adding in 9 micrograms of T3. And they often make the assumption, most conventional doctors make the assumption that T4 is something like 4 or 5 times, or T3, I'm sorry, is 4 or 5 times stronger than T4 when they make these conversions, and that's how this chart was created. But what I'm going to show you here is a better conversion chart that I've created so that you guys can use this, and I think this more accurately reflects converting from T4 medications to natural desiccated thyroid medications to T3 only medications. Okay, so remember in the previous example I gave you, they stated that 100 micrograms of levothyroxine was equal to 1 grain of NDT. And I'm telling you here, in my experience based off treating hundreds and hundreds of patients, I think it's actually closer to 2 grains. Okay, so when you go from 100 to 1 grain, you're being underdosed significantly. And I think to get a more accurate dose equivalent, you need to go up to the 2 grain mark. Now, I don't recommend you jump straight up to 2 grains because that's a recipe for getting symptoms of too much T3. However, I do think you should build up to this dose. So use this chart. I have another video that goes over it in detail, how I came to these conclusions and how it breaks down in terms of how much T4 is in 2 grains, how much T3 is in 2 grains, etc. But what it has to do with is that many doctors get a little bit concerned with using T3 because it is about 3 to 4 times more potent at suppressing the TSH than T4 is, and so therefore they make the assumption that it's that that much more strong than T4, although that isn't always the case. I do agree though that it's about twice as strong as T4. So if you look at this conversion, the one that I give you here, 50 micrograms of T4, I think is about equal to 25 micrograms of T3. Okay, and again, I just want a word of caution here. When you're switching from T4 to NDT, start out slowly with your titration and increase slowly every 10 to 14 days or so. You can read more about that and why I recommend it in this blog post here, but that's definitely an important point. Okay, so number one, you may not, just go over this real quick again, you're probably not being dosed correctly, so make sure you're not being underdosed when you switch from T4 to NDT. Make sure that dose is accurate for you, because the tendency is going to be to underdose you by about 50%. Okay, so you're going to have to know this information to bring it to your doctor if he's switching you. All right, number two, you may just need more T3 added to your Armour Thyroid. So it may just be that Armour Thyroid is a step in the right direction for you, but only gets you maybe halfway there. Okay, so I found in my practice that utilizing NDT plus T3 to be particularly powerful for many patients. And the reason for that is many patients are suffering from these two conditions that I'm not going to talk about in detail because I have posts on them, but tissue level hypothyroidism and euthyroid 6 syndrome. Okay, so tissue level hypothyroidism means that you may have normal amounts of thyroid hormone floating around in the bloodstream, but it's not getting into the cell. And if it's not getting into the cell, it's not turning on the transcription or genetic transcription factors that you need to have the effects of thyroid hormone. Okay, so in this situation, blood levels are abnormally, well, they just look normal even though they're not, because it's not getting where they need to be. Okay, and then the euthyroid 6 syndrome is a syndrome that every doctor knows about. It's also referred to as low T3 syndrome. And essentially what happens in this syndrome is the body, usually in states of chronic infection, chronic illness, acute trauma, it kind of shuts down the thyroid function because it's not as necessary, right? Your body needs that information and that energy to heal itself or fight off the infection or whatever it is that it needs. Okay, and many doctors are familiar with this in the ICU, but they kind of forget about it in patients that are chronically ill. Okay, so the same thing can happen. And I'm talking about patients with, fibromyalgia, chronic pain syndromes, chronic viral infections, things like that. If you've been sick for decades and decades, you're probably suffering from this to some degree. Okay, and both of these conditions, if you have these conditions, you generally need more T3. Okay, so NDT, like I said, may be a step in the right direction, but it's not everything that you need. You may need NDT plus T3. And what I want to talk about briefly here is who needs this? Who needs more T3? And so I've given you some general guidelines here on how to figure out if you fall into this category. So we'll go through those. So patients that tend to need more T3 in addition to Armour or other forms of NDT include those that have high levels of reverse T3. So make sure you're checking that. Those that have leptin resistance, and I'm going to specifically talk about that in the next one below. You might have diabetes, prediabetes, or insulin resistance. All of those further decrease thyroid conversion. Patients that tend to have very, very low body temperatures. It's not normal. It's not normal, guys, to have a low body temperature. Patients who have a strong family history or strong personal history of bipolar disorder, or somebody that has a history of like multiple suicides in their family, or a strong history of multiple psychiatric disorders. Okay, and then again, I mentioned this before, but somebody who has a personal history or a family history of fibromyalgia or chronic fatigue syndrome. Okay, these are all in, if I'm talking to someone in an interview and they're giving me one or two of these, the light bulb in my head's going off. This is probably somebody that needs more T3, and we need to pay a lot of attention to the free T3 to reverse T3 ratio. Okay, so again, number two, you may not have enough T3 added on to the current medication you're taking. Number three, you may be suffering from leptin resistance. And this is a big one. I have another video dedicated to leptin resistance by itself that explains this in detail, but what I'll do real quick is just tell you what leptin is and how it interferes with this process. Basically, when you gain weight, your fat cells themselves secrete a hormone called leptin. All right, and leptin is supposed to tell your brain, hey brain, we've got enough fat here. Let's turn on the metabolism so we can start burning the fat. And because we don't need to eat anymore. Your body's that's a signal that's supposed to tell your body, hey, stop eating. But what happens in leptin resistance is the leptin levels go up, the brain doesn't get the signal, so as you gain weight, your brain literally thinks you're starving. All right, so you can see how this is a bad scenario here. So you gain more and more weight, and your brain's like, where's the leptin? I don't see it anymore because the cells have become resistant to it. And so what it does is it actually decreases your metabolism and increases your appetite, all the things that you don't want to have happen. And in addition to that, the higher leptin gets, the more it interferes with T4 to T3 conversion, okay, which is obviously a big deal. So you have higher levels of reverse T3, your metabolism gets worse, and you almost always have multiple symptoms of hypothyroidism. And I mention this specifically because not a lot of doctors are generally checking for leptin. You pretty much have to be proactive about this, or go to somebody who knows what it is. And first of all, has to know what it is, and second of all, has to know that there is a treatment for it. And again, if you're interested in that or think you might have leptin resistance, check out my other video. It goes over how to test for it, how I treat it, and a number of other things. Okay. I guess I do talk about it in this article, so excuse me for that. But basically, the way to test for it real quick, I'll go over that, is you check your serum leptin level. And it needs to be, I say 12 here, but I generally am using 10 to 12 as the range that you want to be under. So if you are overweight and your serum leptin is greater than 10 to 12, automatically you have leptin resistance and it needs to be addressed, okay? And the higher your leptin is, the less reliable your serum thyroid tests become, okay? So that was number 3. Number 4 is, and I would change that, not necessarily a gluten sensitivity, but you have a sensitivity to the fillers that are inside of Armour Thyroid itself. So here's a chart. It's a little misleading just based off the way that they created it. But essentially what happened is Armour Thyroid's, the ingredients of Armour Thyroid and the fillers were changed. And you can see here, but basically what they did is they reduced the amount of dextrose and increased the amount of methylcellulose. And methylcellulose, what it is you can think of it kind of just like a glue. It binds the hormone into the capsule or the pill that you're taking, the tablet. And so the problem here is that you have to have a functioning GI tract. You have to have enough stomach acid. You have to have enough enzymes to break down the components of which is essentially plant cell walls, in order to get the precious cargo that the methylcellulose is carrying, and that's the thyroid hormone, right? So you can imagine the scenario that some patients are put in. Thyroid hormone is responsible for the production, or well, part of it, it's involved in the production of stomach acid. So if you have low thyroid to begin with, you're necessarily going to have low stomach acid, which means when you take the medication, you might not absorb it all, okay? So the degree of which, well, let me put it this way, the worse your GI tract is functioning, the harder it's going to be for you to absorb the Armour Thyroid, which explains why many patients, not everyone, some people actually, they got better with the switch in it, but a lot of patients started to feel worse, and it's felt to be probably as a result of this methylcellulose filler. So the solution to this is that you may just need to switch forms of NDT, right? They have different amounts. So if I have somebody that comes to see me in the clinic and they have a lot of GI issues, or they're really sensitive, I'll just switch them to WP Thyroid from Armour or from Nature Thyroid to WP Thyroid, because it has the least amount of fillers generally. All right, so that's number 4. Remember that, it's important. And then number 5 is, when we alluded to this before, your reverse T3 is just plain too high, okay? And again, I have videos and articles dedicated to reverse T3 and how important it is. But to recap, if this is like, your first time hearing about this, let me just explain real quick what it is. So T4 is the inactive storage form of thyroid hormone in your body, and T3 is the active thyroid hormone. In order to get the T3, your body must convert T4 to T3. Okay, so that's all well and good, but what can happen is your body can also convert T4 to reverse T3 as a way to naturally kind of put the brakes on the thyroid system if necessary, right? This is just, let's say it's your body's mechanism. If thyroid hormone gets too much, it allows it to kind of change the amount of free thyroid hormone that's there. And reverse T3 is an inactive thyroid metabolite, and it does nothing. It just kind of sits on the cellular receptor and blocks the active T3 from getting on it. Okay, so you can see that in small amounts, it's okay. It's just a natural regulatory process that your body has developed to put the brake on the thyroid system. But what can happen is, in abnormal physiologic states, like I said before, chronic inflammation, leptin resistance, chronic infections, high levels of, obesity, any inflammatory conditions, all of these things can make your body preferentially convert T4 to reverse T3, which is bad, instead of T4 to T3, which you want, okay? And unfortunately, we'll talk about that a little bit down here. But how do you know if this, how do you know if this is even something you need to worry about? So what are the things that cause high reverse T3? So sometimes just giving a patient who has chronic inflammation or any of these things I mentioned, if you give that person T4, you're actually providing them with the substrate necessary to create reverse T3, okay? So let me say that again. If you're giving someone T4 and the body is preferentially turning it into reverse T3, you're just supplying more fuel for the fire, all right? And that's not necessarily what you want. And you can bypass that by reducing the T4 and just giving a patient T3. But sometimes even NDT has too much T4 for many patients. So again, what causes high levels of reverse T3? Thyroid medications containing T4, those as Synthroid, Levothyroxine, Levoxyl, etc. But it also can be NDT, like Armour Thyroid. Inflammatory states, chronic inflammation that's been ongoing can do it. Leptin resistance, like we mentioned before. Insulin resistance, which is a big deal. Up to 50% of people in the United States have insulin resistance. So this is, there's a 1 in 2 chance that you have this. Obesity by itself can do this. This LPS stands for lipopolysaccharide, and LPS is a toxin that can be secreted by abnormal bacteria in the GI tract, okay? And then another huge one is medications, okay? So medications like antidepressants, diabetic medications, anti-seizure medications, blood pressure medications like the beta blockers, propranolol, carvedilol, etc. Those things can also blunt your body's ability to convert T4 to T3, which is what you want. So you can see that that's kind of a big deal. What to do, how to fix it, what you need to do. I generally recommend coming down on the amount of T4 that you have and increase the amount of T3 that your body needs. You can do that by reducing the dose of NDT down to like 1 or 2 grains and increasing liothyronine or cytomel or sustained release T3. Sometimes switching from T4 to NDT is enough by itself as well in some patient populations, but not everyone. It really just depends on kind of how sick you are and what your body's been going through. All right, so that's it on this this video here. And again, I just wanted to point out that Armour Thyroid can definitely help patients. It's certainly not a miracle medication, and I don't want you to go into it expecting that it's going to cause all of this, amazing weight loss for you. It certainly can, but it's definitely not a magical pill here. So if you enjoyed this, feel free to share it or subscribe to the channel. If you're listening to it on podcasts, you can download and listen to it for later use. But again, I try to create as much information as I can for you guys to make it as helpful as possible. So thanks. I look forward to the next video.